Good afternoon, everyone, and Happy New Year. Oh man, 2020 has been a very momentous year for many reasons. Um, COVID, the election, the politics, the the persons who are no longer with us this year, and we would like to just have a moment of silence for them um, right now. Yes. So this year, we are hoping for the healing of our nation and unity to be reestablished and and a decrease in the numbers of COVID persons as the vaccine is being rolled out, and we're hoping that the the authorities will put a positive spin on that and allow people to get it in a timely fashion. So we will just wait a few minutes to see who's going to come with us. And I'm in Charlotte today. Some of you have been tracking me. I was in New Hampshire doing a locums, and I happened to speak with someone yesterday. Said, "Are you still in New Hampshire?" And I said, "No, I'm not. I'm back in Charlotte, and the weather seems kind of gloomy, but it's nowhere near as cold as it was in New Hampshire. So I am grateful. I am grateful." So today we're going to talk about high blood pressure. And people throw around the word high blood pressure all the time. There are people who have it and people who don't want to have it, even though they were supposed to take medicine. But I think it's important to know what it is, especially since a lot of times when people have high blood pressure, that's not the only diagnosis they have, and that's not the only medicine they take. So we want to find out exactly what high blood pressure is and what things contribute to it, because maybe you can work on some of those things now and actually prevent it from happening so early. Also, we want to talk about what happens when it gets diagnosed. Many people are on medicine, they're not sure what it's supposed to do or how they're supposed to feel on the medicine. So we want to go into a little bit more detail about this week and next week, and talk about things next week about how we can optimize when we're on blood pressure medicine. So, you've gone to the doctor and he says you have high blood pressure. You're not sure why the person said that. You feel fine. You're not having any problems at all. So high blood pressure is one of those enigmas. You don't have to have any symptoms at all to have a diagnosis of high blood pressure. It is just a measurable pressure that the doctor sees and realizes it is above normal. Now, in most areas of the country and most authorities have come to an agreement that high blood pressure is greater than 140 over 90. There are some others who feel it starts at a little earlier than that, but we're going to limit our discussion today to blood pressures less than 140 over 90. As I said, most people do not have any symptoms at all, and they feel fine. They go for their routine blood pressure check with their physical, and the doctor notices that was a little higher than it should be. And but some people do have symptoms. They may be fatigued, they may have blurred vision, they may feel out of sorts. And some suspect it because they know it runs in their families. There are different types that cause high blood pressure. There are different types of high blood pressure. Some of those are related to other diseases, but we're going to limit ourselves to what we call essential hypertension. And that is the blood pressure that everybody has, but nobody knows what causes it. Literally, nobody knows what causes it. Some of the reasons for high blood pressure, or what puts you at risk for high blood pressure, can be your age. It is well known as people get older, more and more people have to be put on high blood pressure medicine. If you have never had blood pressure problems before, as you get older, 65, 70, you may need to take some. The other reasons that people may have high blood pressure are really genetics. Afro Americans tend to have a higher load of high blood pressure, so do Latinos and American Indians. Family history, as I said, genetics can play a large role in that. And let me just tip on pregnancy. Additionally, we're finding now that some people who have, strategic problems with their pressure during pregnancy may go on to have problems later on with their pressure. Not being physically active. If you have a job that makes you sit down all day and you rarely get up and you're doing it for 10, 12 hours a day, you're considered at high risk. And now with COVID and everybody's at home and we are doing, hi Daisy, how are you? Happy New Year to you. I had thought about you today. Happy to see you today. And we're talking about high blood pressure today. If you have any questions, just type them up in the chat there. Smoking is another reason why we should not be, another thing we should really be working on. Smoking, within a few minutes of smoking, you do have an elevation in your pressure. That's just one cigarette. But think about all the people who smoke at least a pack a day. They are going to have high blood pressure. They're going to develop high blood pressure, almost certainly. So think about that. And so some of these things, there are more than one risk factor that patients do have when they're diagnosed with it. Too much salt in the diet. During the legislation for the Affordable Care Act, better known as Obamacare, the leaders in that group decided that they were going to work with the manufacturers and try to get a decreased amount of sodium in the foods that are purchased or put on the shelves. I'm not sure if that was completely rolled out because we had a new administration, but that was one of the things they cited as a problem. Many people, we tell patients to stop taking, a lot of salt, but what do? This is the only thing that they have available to them sometimes. Also, excess alcohol. Alcohol is a chemical and creates conditions in the body that can raise your blood pressure. Now, we do allow a certain amount of alcohol per day, but anything in excess of this is considered, probably you need to talk with your doctor about it. 12 ounces of beer is allowed per day, 5 ounces of wine per day, and 1.5 ounces of hard liquor. I think that's excessive. The hard liquor each day, I think that can lead to other issues. So I would say with the alcohol, find out what your doctor feels should be the right for you. Now, wine, we can say in those countries where they have wine, a glass of dinner wine, they tend to have lower cases of heart attacks and stroke. And there's the resveratrol in it that they have noticed has contributes to a decrease in the amount of heart attack and stroke. So you can purchase that without even buying the wine. Life stressors can put you at risk for high blood pressure. And you may notice that most of these risk factors, people have usually more than one. How many people do you know have stress and and they may be older, and they may have high blood pressure. Some people smoke, they have high blood pressure and many other things. And the other thing that contributes to high blood pressure is excess weight. Being overweight or having weight in excess can put you at high risk for high blood pressure. And sometimes just that alone will put you at high risk. Now, why are we so worried about high blood pressure? Why do we make a big thing about high blood pressure? And when you go into the doctor's office, they've got to check it all the time. The problem is that blood pressure by itself is not something that just, is there by itself. It can, if not treated very well, you can go on to have complications from the high blood pressure. And one of the main ones is heart attack. Many people know someone who's had a heart attack. And that's when people clutch their heart and they're short of breath. And some people even pass out. And you call medic picks them up and takes them to the hospital as fast as possible to see if they can minimize the damage that's caused by the heart attack. Another complication is stroke. How many people have seen someone who cannot walk the way they should walk, or they can't talk, or maybe they don't have the strength in their limbs, or they're not able to use their limbs well, or they can't remember things? That's from, high blood pressure that's not well controlled. Another complication, which is becoming very prevalent, and a lot of people don't know about this one, it's called heart failure. This occurs after patients have been on blood pressure medicine for years, and the blood pressure may not be well controlled. And well controlled means that they meet the guidelines that the authorities on hypertension in this country have set to make sure that we keep the blood pressure down. And what happens is your heart is pounding and it's trying to push blood into your limbs, your lungs, your arms, your legs, and other areas of your body. But if it senses pressure in your body, it has to pump harder. And so if the blood pressure medicine is not working, it still has to pump harder. And this goes on for years. And then after a while, the heart can't pump anymore. And what happens is it becomes flabby. The muscle can't work as well as it's supposed to. And some patients find that they have, fluid in their lungs. And that's how some people describe it, fluid in their lungs. But it's because they either did not take their high blood pressure medicine, or they just continued the same blood pressure medicine they got, never told the doctor they were having any problems. And the pressure wasn't where it should have been in those years prior to that happening. We talk about high blood pressure all the time. What is the big deal? How is it diagnosed? The blood pressure itself is a measure. You've seen blood pressure cups, and you've seen, they pump it up and they check and they give you two numbers. And a lot of times people don't believe the numbers the doctor gives them, but most authorities in the country now have kind of come together and decided that one blood pressure is greater than 140/90 are admissible to diagnosing high blood pressure. There are some other definitions of high blood pressure. We won't go into them now, but for the sake of this talk, we'll stay with 140/90. And that means that you've come into your doctor's office on several occasions and your blood pressure is higher than that. And but you're saying, well, I'm not sick, I'm not tired. How are they diagnosing this? Remember what we said. Some people with high blood pressure don't have any symptoms at all. They're, walking, talking, nothing wrong with them. And that's one of the issues with high blood pressure. People feel that, well, if I'm not as the saying is, don't, if it's not broke, don't fix it. But that statement can get people in a lot of trouble, because if we find high blood pressure early and we treat it sufficiently, we can avoid a lot of the complications that people go through, and some of the suffering that they go through also. So the definition for high blood pressure is greater than 140/90. And to make the diagnosis, you have to have 3 separate blood pressure readings that are greater than 140/90. And that will solidify the diagnosis for you. Sometimes the doctors have you come back. Sometimes, people, if they're at school, they can have the nurse check their blood pressures. Sometimes, there may be a medic nearby. You can get your blood pressure checked then. I've noticed that the pharmacies are no longer having blood pressure cuffs there anymore. And that's probably because of COVID also. So you may want to get your own blood pressure cuff just to make sure. So on the day your doctor diagnoses you with high blood pressure, usually they give you a medicine. And many people feel very uncomfortable taking medicine, because what I hear most often is, well, I'm not a pill person. And what I say to people is, I don't think anybody's a pill person. It's just that that's how it comes in. I mean, I don't think people want to take injections for blood pressure medicine. So it's a benign way of bringing about, resolution of the high blood pressure. And one thing I want to caution you on, please, please, please always ask your doctor where he or she feels your blood pressure should be after taking the medicine. Should it be 130/60? Should it be 132/72? What range should it be? Because I often find when I, work and I'm there because people are on vacation, I'll say, well, what's your blood pressure usually run? Well, I don't know. I'm just taking my medicine. You should really know where your blood pressure should be on a regular basis, and where it normally runs. And likewise, if you're still taking the blood pressure medicine and your blood pressure is even higher than the 140/90, chances are that that's not the right medicine for you, or your doctor has to tweak it. Usually on the day that you get diagnosed, you will also get lab work. And lab work is a baseline lab work just to make sure that if there's any medicine that you're on that may change the lab work, they will know what your lab work is before you take any medicine. So we've asked you to make sure what your blood pressure goals should be, your doctor's blood pressure goals for you should be, so that you can keep track of it. And the other side of that is you can let the doctor know if the medicine's not working. Also, make sure that you go over the side effects with the pharmacy. I have seen those readouts from the pharmacy. You can't even read them. They're in this Lilliputian print that you can't see, even if you put a magnifying glass on it. Go over them with the pharmacist, because there are times when you may not think that the medicine has a side effect, and it may be something subtle, and you will know, I guess within reason, that may be something you need to discuss with your doctor. So we want to talk about optimizing your blood pressure. I don't think anyone talks about that, but for lifestyle changes and for you to feel your best, there are lots of things that people can do. And we're going to talk just a brief amount about some of them today, but next week we will talk about optimizing your health. Number one, make sure you decrease the amount of salt that you use. When you add salt to your food, just decrease that amount. Just, as the days go on, just decrease it more and more. Additionally, if you buy pre-prepared foods, make sure that it's low salt. And low salt is defined as 200 milligrams or less. I have looked and looked and looked, and I have not been able to find very many low salt foods. So I would say the lower the better. I think the lowest I've seen is 250 to 300. So I say would stick with those. Get started on an exercise program. Ask your doctor if he or she feels that you would be able to engage in a physical activity program. And the reason being is that most people who have high blood pressure have they're overweight or they have excess weight far and above that they need to be carrying at any specific time. And this is a time for you not to think of the diagnosis as, oh no, I've got to take a pill. This is a time for you to take stock in your health and revisit some of the things that, well, number one, that's in your family, that your family know. And number two, a time for you to center on being your best self, making sure your pressure is down. And I have seen some patients who have taken this very seriously and have optimized their weight. And sometimes patients, especially if they're younger, can be taken off blood pressure medicines or it could be reduced substantially. And the weight loss program, in addition to taking the blood pressure medicine, is something that you do for you. It should not be a burden because oftentimes many doctors don't even go into it with patients. This is something that we're telling you to and recommending to you because it optimizes your health in many ways that you cannot measure at all. Additionally, exercise, and we've talked about exercises earlier on, how you'll have more energy, patients feel very satisfied, it brings about a sense of well-being. And in these days and times when there's so many things going on, it's always good to find something else you can feel good about. So today we've talked about the risk factors for high blood pressure, what causes it, and we've told you that most of the time they don't know what causes it. And we've talked about some of the risk factors. So if you don't have high blood pressure, think about those risk factors and how, if you have any of them, how you can modify them so that's not a risk factor for you for high blood pressure. Additionally, we've talked about how it's diagnosed and some of the early things that you can do to optimize your diagnosis. So, I am Dr. Hope Watts, board certified family physician, health coach, speaker, and lifestyle manager. Please follow me on Facebook, Instagram, Twitter, and LinkedIn. And I just want to put a little plug in there for my book. My book will be coming out. It's called Body Fix, The Ways to Lose Weight with Confidence. I will be keeping you updated on that in the months to come. So I hope this has been helpful for you. And next week, we will talk about other ways you can optimize your lifestyle on high blood pressure medicine and making it probably more, not of a burden, but more integrated into your lifestyle and other things that you can do for yourself to make yourself feel better and have a handle on your blood pressure and not take things into your own hands and think, oh, I don't need this medicine. And I can't tell you how many times I've seen patients who have not taken their medicine, and here it is 10 years later, and they have a major complication from it. So you don't be that person. Don't be that person. So happy New Year to everyone, and I hope that this talk was helpful. Goodbye until next time. Now, Daisy, do you have any questions for me? I forgot, I didn't ask. Do you have any questions for me? If not, well, thank you, Daisy. I'm glad it was informative for you. And we will talk later. So thanks a lot.